Self-scanning method. If the therapist desires to scan himself, obviously he will not be able to check and compare the length of his own legs, but he can lie on a couch or bed and check each scanning point with the help of a relative or friend who compares the length of the legs. But if he really cannot ask anyone for help, then he must check the shortening or lengthening of all his right hemisphere, not by comparing his legs, but his arms or hands. It is more difficult to detect this in the hands than in the legs, but it is not impossible. The therapist patient then has to lie because this way the scanning magnet will hold by its own weight in most body areas. The therapist patient will join hands and compare, for example, the knuckles of both fists, or the right thumb with the left thumb, or the right index finger with the left index finger. In the latter case, one should place a mark in the hands with some tape or draw them with a pen. The purpose of these marks is to have an initial reference. The line marking the fold of the last joint of the index finger is a good benchmark. Then both hands are joined by matching all the folds of the right hand with the folds of the left hand. The therapist patient must make sure that the initial marks are matching. In this way, having this initial reference, he will check later if the hand is shortened or lengthened by placing a negative magnet at some scanning point. We insist that it is not only the right leg that shortens or lengthens, but the whole right hemisphere. Therefore, the self-scanning protocol and rules to be followed are the same as for making a normal patient scanning, which we discussed earlier. This scanning method can also be used to test a person with disability or amputation in one of his legs.